When you're pregnant, the NHS will offer standard scans and screening to you. At Innermost Secrets, they've developed additional scans to ensure the safe development and delivery of your baby. Bryan, what scans do you offer in addition to the ones that the NHS offer?
Usually within the NHS there would be a scan at about 12 weeks to pick up twins, to determine when the baby's actually due and to make sure that the baby is okay and developing properly. And then again at about 20 weeks to check on the overall development of the baby. But that's usually all. In early pregnancy, a lot of women are concerned about the possibility of a silent miscarriage. Sometimes it's possible for a baby to pass away without actually being aware of that. And people may not then discover that until their 12th week or their 20th week. And so we have a series of ultrasound scans which is offered on a weekly basis from about 7 weeks when you can first see a heartbeat right through to about 13 weeks. Which is kind of past the time when most miscarriages would occur. And a lot of people find that very useful and very reassuring.
What about later in pregnancy? What additional scans have you for then?
Well, the 20-week scan, as I say, is done in the NHS and it's done to a universally very high standard. But beyond that, they wouldn't normally do any further scans, and we rely on measuring the size of the bump to try and gauge the growth of the baby. But we know that we miss about half of babies that aren't growing properly by doing that. And so they have a package of scans called the Safe for Baby package, which involves a scan at 24, 28, 32 and 36 weeks, so that you can accurately monitor the growth and the development of the baby in the second half of the pregnancy. And at 36 weeks, it's also important to make sure the baby's head first, because about a third of babies who are coming as a breech, i.e. bottom first, are missed by just examining the tummy in the normal way.
So why is that important?
If a baby is coming as a breech, we know that there's a higher chance of the baby getting stuck if somebody's aiming for a normal delivery. And therefore, if you know that the baby's breech, you have the option to try and turn the baby round at about 38 weeks just by manipulating the mum's tummy or by doing a caesarean section, rather than trying to deliver a baby which may be a very traumatic delivery for both the mother and the baby and damaging both.
Would you recommend that women come here for all of their scans in pregnancy?
No, the 12-week scan, which is done in the hospital, and the 20-week scan, as I said, are done to a very high standard across the NHS. But the problem is that most hospitals don't have the resources to provide the ultrasound scans that we're able to provide in the private sector.
And what about testing for Down syndrome?
Down syndrome is a huge concern for many couples now. Many people are leaving it later to have a baby, and we know that the older the mother is, the higher the chance for having a baby with Down syndrome. Conventional testing based on a blood test at about 15 weeks will pick up about 60% of babies who have Down syndrome, whereas an ultrasound scan and a blood test called a nuchal translucency scan, where they measure the amount of tissue fluid at the back of the baby's neck, will pick up something like 90% of babies who have Down syndrome. The other important thing is that if you have a high risk for Down syndrome, the next step is to consider an amniocentesis. And the chances of having to make that decision are much lower with the nuchal scan compared to the triple test. So a lot of women in the UK at the moment who are having an amniocentesis because of their screening test for Down syndrome could have avoided it if they'd had the nuchal translucency scan instead.
At the anomaly scan, they look at the development of the baby, but are there any things that they can't pick up?
Yes, the anomaly scan will only pick up about 70% of all developmental problems, all structural problems with the baby. And one of the things that we're not very good at is picking up heart problems. They reckon that something like 50% of babies who have cardiac defects are missed on the 20-week scan. And in fact, cardiac defects are more common than Down syndrome, and yet people tend to worry more about Down syndrome. By having an ultrasound scan at 24 weeks and looking at additional views of the heart, you can pick up a substantially greater number of babies that have heart problems. And that's extremely important because the immediate care of the baby, and indeed where that baby should be born, will have a huge impact on the outcome if the baby has a heart problem, especially if it's been missed.
So you've talked about some of the additional scans that you can have, but do you offer complete antenatal care to women?
We do. We will actually take women from the time that they've got a positive pregnancy test and see them regularly throughout the whole of the pregnancy, and then actually be around for the delivery, so that if they do need any assistance, you've got somebody there who you know and who you've hopefully developed a good working relationship with to support you through that most important part of the pregnancy.